Traumatic brain injury in school-age children. Here are the characteristics of TBI. Traumatic brain injury can cause changes in cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perpetual, and motor abilities, psychosocial behavior, physical functions, information processing, and speech. The definition of traumatic brain injury is an injury to the head that interferes with normal functioning of the brain. TBI is the leading cause of death and disability among children. In newborns, a TBI would most likely be from delivery or a hematoma. In infants, traumatic brain injuries would probably come from accidental head injury or abusive head trauma. In toddlers and school-age children, TBIs could come from accidental head injuries. And in adolescents, TBIs would come from bicycle and motorcycle-related incidents or sports-related head injuries, for example. Here is the identification process for TBI. This is difficult because a TBI often shows no visible impairments. Typically, a doctor would conduct a CT scan of the child's head. TBI could range from mild to moderate to severe, or be temporary or permanent, depending on the area of the brain that has been affected. Medical implications. Traumatic brain injury can cause epilepsy. It could also increase the risk of Alzheimer's, Parkinson's, and other brain disorders. Long-term follow-up with doctors is often needed. Here are some TBI statistics. An estimated 475,000 people in the United States, ages 0 to 14 years old, sustain TBI annually. About 75% of TBIs that occur each year are concussions or other mild forms. Academic implications. Although it varies greatly from case to case, traumatic brain injury could cause problems with speech or language, memory and retention of information, and processing skills. Because of this, students may require small group instruction or removal from the general education classroom to meet their individual needs. Also, because TBI could lead to speech or language impairments, these students might be reluctant to speak up in class. Here are some teaching strategies that you could use with students who have TBI. Repeated practice, memory games, break information into smaller chunks, demonstrate new tasks and concepts, provide rest breaks, use schedule organizers, avoid figurative language, reduce distractions, use frequent reminders, and have regular communication between rehabilitation specialists, family members, and educators. Social and emotional implications of TBI. Traumatic brain injuries could affect the social and emotional well-being of children. It could lead to significantly lower self-esteem, higher levels of loneliness, aggressive or antisocial behaviors, and fewer close friendships. Students who are struggling with these skills might benefit from the support of a therapist or a guidance counselor. Here is a list of resources for both parents and educators. There is the Madonna Rehabilitation Programs located in both Omaha and Lincoln, Nebraska. The Brain Injury Rehabilitation Programs at the ChildServe locations. The Center for Parent Information and Resources is an online tool, and the Brain Injury Foundation. Here is a list of all of the sources that I used in order to create this project. I hope you enjoy.